Things have changed somewhat since the last time we talked. Um, we have slowly moved towards our typical enrollment while still maintaining small group sizes. What we're facing now is managing exposure and quarantine time and having enough staff to operate the center. So I had a teacher last week and she was at her grandmother's house and she went to get tested that Monday. Well, Monday afternoon, they called her and said she was positive, but that impacted my infant room lead teacher, who's now out for 14 days. So, in the midst of trying to hire and train new staff, I'm constantly running behind. I feel like I can't get caught up because it doesn't matter how many I hire, it's not enough. I think we've got 8 on our quarantine list now that we're tracking to make sure the date that they were last here, if they were tested, what that date was, where their results are. And I really need a full-time person on the admin team just to manage and track all that data. Financially, our situation is definitely not any better. Where we are right now with probably 92% enrollment, we'll be back to 100% next Monday. So our tuition, our weekly income is the same as it was before Corona. But our payroll is so high now because of the small group sizes. Everything that we do now costs us more. Our food costs have gone up. Delivery charges have increased. Our overhead expenses have gone up. Our insurance, we got a notification the other day that our insurance on the property is going up. So everything that it takes to operate the business has increased in response to the virus. And so without passing on a tuition increase to our families, I just don't see how we can sustain all the additional cost without some support from somewhere. And honestly, I'm not sure that financially families would be able to pay what we would have to increase to. I mean, some of these things are double what we were paying before. We would be looking at a, roughly $40, $50 a week increase. And I don't know that our families can afford that. Well, I haven't necessarily doubted my decision to stay open. I believe that as childcare providers, we are essential employees to sustain the workforce. It's been very, very difficult. It's been extremely stressful on our staff, and we may not make it. So our family has been in small family-owned business since 1971. So this December of 21 will be 50 years that our family has been in a small business here in Clinton. And the thoughts of not making it to that 50-year mark are very depressing. And it's a lot to kind of try to process and work through.
Childcare is essential for many American families to be able to return to work. But 30 to 50% of childcare providers in the United States have closed their facilities, and many may not reopen. Necessary enhanced health and safety measures due to COVID-19 could also lead to providers serving fewer children, which may impact how much childcare is available to families. An overwhelming majority of Americans support providing targeted federal financial assistance to childcare. Congress must act to ensure that childcare has the robust, dedicated relief it needs. Visit childcareaware.org to learn more about how to advocate for childcare. It's as simple as this: no childcare, no recovery.